Good afternoon, everybody, and welcome to our webinar. My name's Karen Bowness. I'll be the webinar moderator today, and I'm the marketing manager here at Medtech. Thanks for joining us. Today, we're going to be talking about PenCat and the any updates that we've made since we had our last session. You'll probably remember we had a session not too long ago, or a few months ago, I guess now, when PenCat was first released. I'd just like to welcome to you our presenter, James Rohde. Hi, James, who's here with me today.
Good afternoon, Karen and everybody. Welcome.
Okay, so we've got a lot to cover in a relatively short time. So I'll just, how do I get your agenda, James? I need my agenda.
Yeah, there you go. Go back
Got
to the
too many,
moderator.
there it goes.
Thanks, Karen.
Okay, so here's the agenda, everybody. So we're just going to have a couple of minutes of housekeeping just to make sure everyone knows how to use GoToWebinar and are clear about what the format for today is. So we're going to do our housekeeping, then I'm going to hand over to James, who's going to talk about the update for PenCat and PIP QI and all of that. We've got time at the end, lots of time at the end for questions, and hopefully we'll finish at about 1:45. So if you're having any problems or any questions, please feel free to send them through. Hopefully you have the GoToWebinar control panel on your screen. That looks a little bit like that. I must have pressed the wrong button, sorry. Stop laughing, James.
Oh,
I'm having
no,
trouble.
I'm not.
I'm having trouble driving.
Not
Sorry,
at all.
everybody. Anyway, so here we go. Here's the control panel for GoToWebinar. If you want to minimize it so you can see the full screen, just click on that orange button. All of these options work as a toggle, so they turn things on and off. So to minimize it, just click on it once and it will minimize down to be just the gray bar. To maximize it, just click on it again and it will bring up this full control panel. The option underneath just shows you that your microphone's muted. The square underneath is actually a window, and that allows you to control whether your background window is in full screen or minimized. So you can, again, works as a toggle, so just click it on and off. The option underneath is hands raised. So if I can get you all to give me a hands raised if you can hear me clearly, that will be good. You just click on that. Yep, got a couple of hands raised. Thank you for that, folks. And of course, if you want to ask us a question, simply type in your question here and press send. If I know the answer, I'll answer it straight away. Otherwise, we'll leave it till the end and James will answer it during his Q&A session. So I'm going to pass over to James now, who's our training and implementation manager. I'm sure you all have met James before. He's an expert on all things PIP QI and PenCat. So hi, James, over to you.
Good on you, Karen. Thank you very much, and welcome everybody. I guess the first thing I'll just confirm that we can all see my agenda slide there. So Karen, maybe I'll just get a tick off from you that you can see that.
Yep, I can see it. Thank you, James.
Fantastic. All right, so we've got a pretty jam-packed little schedule there today, and I guess this is rolling forward from our previous PenCat update. So I just wanted to really sort of go back in time for everyone just to understand the observations of what we know, what we've seen from the primary health network for previous submissions, understanding the process update as it is, and then just running some use cases on some of the quality improvement measures. So just everyone's sort of clear, what we do, how we integrate with the CAT4 tool or PenCS, and then how that integrates with the PHN or the primary health network. All right, so it's a pretty jam-packed slide first and foremost. Just move back there. Let's get some of this stuff out of the page. Okay, so basically, going to the actual program itself. So as we all know, and those that are new to this incentive program. So basically, the PIP itself, incentive is a payment to general practices for activities that support continuous improvement in patient outcomes and deliver the best practice care. So generally speaking, general practices enrolled in the PIP QI incentive commit to implementing continuous quality improvement activities that support them in their role of managing their patients' health. So there lies in sort of the mainframe or the mantra of what we're trying to achieve with the PIP QI program. So specifics of that is the improvement measures allow general practices to understand which patients may benefit from preventative treatments or may need to recall to ensure effective management of specified sort of chronic disease, i.e. diabetes. This can help delay progression of condition, improve the quality of life, improving their life expectancy, and obviously, look at things like decreasing the need for high-cost interventions. So therein lies this first screen, and we're going to go through these, in detail in the first little portion of everyone on everything, and then obviously go into the actual process itself, and then to the use cases. So this screen basically shows that the quality improvement measures. So basically the collection of de-identified improvement measures that form the PIP eligible data set are part of a system of quality improvement that includes reflective practice, a common data baseline, and a data analysis. So what I wanted to show, and what we will go through in more detail, I know there's a little bit of rendering happening on this page, so I apologize for that, but we've got obviously 10 measurables that are there. So forming on the left-hand side is obviously the improvement measure itself, then obviously into the description of that measure. And what I wanted to classify there was, really what the PHN are focusing on from a categorization point of view of the data, and then how it's extracted. So the first portion there is obviously, point one, proportion of patients with diabetes with the current HbA1c result. So obviously we know that's the measurable itself, and then it's classified in a data category as the following. So we know that would come under a diabetes type 1 extraction, and that's probably bottled up there, but the category itself that they're looking for is that diagnosis. And the same goes as far as their response from, say, the pathology reporting. That's the classification, or that's the way they're sorting through to find that. So pathology, and then you've got to basically, the extracted data they're looking for is that particular there. So HbA1c, last known result, and date of classification, date range. So, and this goes through basically all of them. So, so the next one being a major key item there is, the proportion of patients with smoking status. Obviously, the categorize itself, it's, obviously the patient side, and then again, it's looking specifically for the extraction of the smoking status and review date. So I might not go through all of these, but I just wanted to focus on some major key ones as we're going through this table. So because we've had a lot of response and feedback on certain items. So smoking, that was obviously one of the, diabetes being a key proportion QIM description. Item 4 there, you can see again, categorization as immunizations. Okay, and understanding that proportion of patients aged 65 and over, and it's going to follow up through the other results as well against influenza. And therein lies the extracted that they're looking for, where it's influenza vaccine last recorded date range, and then the refused date range from that proportion. Hello. You go, Karen, it looks like I'm having the same, there we go. Okay, so again, this page really similar, obviously concept, but from the feedback we're getting for like issues we've seen, with extraction within Medtech before it goes to collection of data from PenCS, and that's reviewed by the PHN. So we look at, there's another couple of major ones on this particular slide, and then the last slide actually has the two more major ones, so I'll point to. So QIM 7, proportion of patients with the alcohol consumption status. And again, the categorization is obviously the patient, and the data extraction they're looking specific for is like the status of the alcohol. So, I mean, and that's pretty self-explanatory. Just a note on points, 5 and 6 there. So you can sort of see, obviously different components from a description point of view, but then there's an obvious connection there when you look at the diagnosis that they're reviewing on. So you can see it's also involved the diagnosis for type 1 and type 2, despite you'll see that there's obviously a difference in the description result there. So in the actual, and these two ones are also major ones that we've noticed. So obviously very much attributed when we look at the, what our main demographic is within the GP space, and then obviously in the specialist space, but obviously specifically around GPs. So part 10 there is obviously a big key one when we talk about proportion of patients with diabetes, with a BP result. Again, there's no disconnection there between what they're looking for, but again, diagnosis, extraction data is more focused around, what type they are. And again, the measurable or the category they're looking for is specific to BP. So the blood pressure, 120/80, just understanding the differences in those measures. The other one, obviously very, prevalent, is 0.9 there. Particularly for those that, have a patient index that are decided from a female demographic for cervical screening. And again, the category they'll look for, obviously there's going to be, a response back from pathology type review. Those records are coming back, and they're specifically the extraction they're looking at is like, the last reported date, talking about the screenings and, when they've done that screen and when the last recorded date of a screening happens or occurs. Okay, so what I wanted to point to with this workflow on this is basically, sort of where we're at the moment with submissions. So you can sort of see on the left-hand side here, we basically just got a bit of a workflow that's showing how Medtech in an end-to-end way integrate within all parties and how that's going to work in the process, process flow for the extraction of the data. So you can see sort of point 1 there. This obviously is information that we have direct for the next submission of the PIP QI data set. So you can sort of see what the PHN are obviously looking for. The latest submission of the data manipulation occurs there for eligibility between May 1st and July 15th. So at the moment, we've obviously had previous submissions that have obviously gone to PHN that have reviewed. So this particular, there's the particular guidelines there. So you can see eligible practitioners will run mapping functionality on the declassified data set. So yep, same as sort of what's occurred there. And so relating to this, so the first line is obviously, the first component of that is obviously like, that's the date range that we need to make sure that there's been the submission there to the PHN. The next bit goes more into what Medtech are doing and what you need to do within Medtech. So we're going to go through obviously how, again, to do the mapping for certain components and extraction. So that's the first portion. And then obviously the final extraction of those measurables need to be completed and then obviously submitted to the primary health network. So I've got a little a bonus thing on the bottom there that basically we'll go through later on, just more about how the data set looks in Cat4 and PenCS and how we can submit based on those data categorization that I had in the previous slide. So the general process is, we know we've got a time frame there from the 1st to the 15th of July to get the submission in. First phase is that we get the mapping correct. run the extraction for the proportion of data that we need after hours time frame within Medtech, run the collection within the Cat4 PNCS tool, submission to Primary Health Network with a fair understanding on what they're specifically looking for. So this is more just like a breakdown, and we'll go into more detail. So I mean, for those who haven't seen this in the Medtech Evolution software, there's obviously the latest version of this software. It rolls up from anything from 10.4.4 to 10.4.6. So I know we've reflected on this before, but obviously we'll go through this in general on how the tool looks. But the starting point, there it is. The PenCat tool itself is found under Utilities, scrolling down to the PenCat icon, and then it'll obviously populate the database that we're ready to extract for the relevant data, and then we start that sequence. What this slide just presents is obviously the differences between the mapping and then the final extraction. You can sort of see on the mapping tool there, it's pretty descriptive, and I'll go through the actual slides and how we can actually extract the relevant data. But obviously there's been a lot of work going into this area there within people within the practice. So we normally speak to either some of the nursing staff or one of the providers within a standard GP, just to go through the specifics of that improvement measure and how they're going to get the data set that they require. And then we're going to go into the tool, and obviously then run the extraction, which is here on the right hand side on that. Now, a lot of the time, we have obviously customers there that are within our Medtech, cloud environment as well. So, a lot of the stuff that we can do, our support team have been assisting in order to extract that data in an after hours format. And a lot of it is obviously important. You might have, 60,000 or 80,000 odd clinical records in there that it needs to cipher through. So it's about understanding, what we're mapping against, and then how the active or the extraction tool represents. And just a note, you can sort of see that, and I will go through this anyway, but the extraction options there, it does give you the ability within Medtech to actually see, inactive patient lists. And if you want to only, you can do a test option there, which is highlighted on the right-hand side there, to really just minimize or just really precisely pinpoint, are they active, are they inactive, is it a full extract you want, etc. All right, so a bit of a use case that we were going to discuss. So you can sort of see there, we're using example proportion of patients with diabetes for current HbA1cs. That was obviously the first item there. And, it's just more about like understanding within Medtech. What I have noticed is that, like, obviously everyone needs to understand how the data is actually being pulled, from Medtech. So to understand where that, we obviously talk about, we understand that particular, that this particular query is based on the actual patient classification. So you can sort of obviously validate, and obviously this very much is just an example of the broader how we're going to extract the data, but just to get a clear understanding on how that works. So this one's obviously part of the classification. You can sort of see, it's going to give you the information in there in the new patient classification wizard. In that, it can sort of it'll show you like the classification types, etc. Where that's visible is obviously within Medtech, and pretty much like everything tends to be within those who are quite evo prevalent. Like the data screen of the patient details are obviously within module. So for this particular one, obviously it's in module clinical new patient classification. And then obviously I did speak about earlier, obviously if it's type 1, type 2, that's the capturing of the set from within within Medtech. All right, so then again, so at the same token, with that, obviously, we also have to understand when we talk about the classification itself, we're also going to understand the terminology for the patient screening side of it, because obviously that's justified. You've been able to locate that it's a HbA1c. So we talk about the screening term itself. So what I wanted to just highlight here, again, in module, understanding, where that is as far as the patient screening entry itself. And then you can actually see specifically there. So I've just put a note that obviously you're going to select that it's a HbA1c, and then understanding that there's a code drop down box for that. And for me, I find this to be the best way to validate before we go into the mapping tool, to understand, what the screening is itself, what the classification, how that's monitored, and if you need to enter any additional data in there and understanding the code itself, it's going to be in there specific to that particular patient entry. So how that replicates then into the mapping. Okay, so you then obviously gone into Medtech, into the utilities area there, and gone into the mapping tool. So in that, it's going to give you a list of the defined, measurements that are in there. So for an example of HbA1c, like we obviously understand that we understand the classification and the screening term there. So you can see it's pretty much self-explanatory for that particular screening term. So the measurements there on the left-hand side there, and it'd already be preordained or pre-mapped to say yes, as you can tell in that regard. Also, this obviously goes across to the other tabs as well. So there's other measurables that are going to be, or reviewed for the smoking and alcohol and immunizations. So you can see, again, going back to the screening term, then just selecting the measurement that's applied in full. So once we've understood where within that information sits and the terminology, that's very common terminology of the screening term, we're going to be able to understand the measurement. So on this particular screen, I just wanted to go into how that is then viewed within PenCS or the CAT4 tool. So this is, again, the end-to-end pathway of just understanding what they're seeing. And when we go back to how I was talking about categorizing, you'll see that, like, you'll see the value of where that is. So here we are in the CAT4 tool, and obviously, we're going to go through a portion that I will take everyone through on the extraction, but we've obviously gotten this particular QIM, we've understood where the screening term is for that particular patient. We've then done an overall mapping of all the records that we want. So the data has been extracted, because that's more than likely going to be an after hours type activity. And now we're in the PenCS tool as a validation point for submission to the PHN. So you can sort of see there's just a breakdown there on how you can actually go in and the data that you're going to view. And if you actually go back to point 3, see it's all in line with what we were saying with the requirements there for pathology, etc. So, from that end, going through those checkpoints to get a final collection of the data and how that's going to look within PenCS. This screen probably should have been before, but again, so extraction of the data before you get into the PenCS tool, you can sort of see there. So I've just taken a snapshot. So basically, an index is all the extract that you wanted to do. So once you're happy that you've collected all the data set that you needed to, and we've done the review and said, well, this is what it's going to look like, we then run the full extraction. Now, as I said, can be a pretty late night activity, because it can be a lot of information that's in there. That information itself will obviously then get extracted to a folder. I've highlighted it there. I mean, in this scenario, particular folder is already like a downloaded folder that is within the cloud because it's going to be, pushed to that particular directory, and then sets it up or segregates it into an XML format. So that's the XML format that can be then, referenced within the collection of PenCS. And I've just put that there as a highlighted pathway. Okay, now the last bit of this, when we're talking about, so the slide probably should have been before, but the PenCS side as well. Obviously, they've got multiple ways of submission themselves. So when I look at the data set here, basically I've just shown that it can be submitted in a different way for the PIP QI data set via CSV. So again, extraction into the collection tool within PenCS and then shown by CSV, and then submission to PHN. So you can sort of see here, I've just taken an extract there, and it's shown the different reporting function that can be seen. Also presented as a standard report. And you can sort of see there, I just wanted to present this to everyone so they've got an end-to-end. So you can see that the first tab will provide the PIP QI report, and then obviously that's exported into the standard Cat4 report function. So I just and you can sort of see, I don't know if it's a bit too small on that page, but end-to-end you can sort of see I've tried to really focus on here, like what I would deem as the most practical way to submit that report. So you can sort of see that like it's all relative to the starting point of the first measurable, and then obviously understanding the recorded percentage, not recorded, etc. Okay, so I just wanted to re-roll again, just so everyone, just on a different one, which, as I said earlier in the presentation, is probably another major one, which obviously affects the female demographic there with the cervical screenings. Again, understanding the screening on a particular patient, that we've got there, and understanding their entry classification, and then obviously capturing the result of that screening entry. So in this case, it's a HPV test result, which I've got on the screen there. Again, going into utilities within Medtech, understanding the measurement itself. You can sort of see there that it's already, we've mapped it. So you can see in the drop-down list that it says all the different PenCat items that are in there, following that protocol. So HPV test, yes. Screening term, we can actually define and review the measurement. And again, now I'm not doing obviously the CSV extract again, but again, condition screen in Cat4 tool, understanding the status, population, age demographic, and and the view that's in there so you can validate the data before it's submitted. So again, if you for that particular aspect, just understanding that again, more to do with the terminologies and the screening terms themselves, and then understand the individual need to map that particular data set. Okay, so obviously, before we go into to just whereabouts we can find further information on PenCat there. So obviously, we've been in a position at the moment where we've progressed quite significantly and helped out quite a lot of practice to obviously get the first round submissions, and that's obviously been a real bonus. But I suppose from our from the Medtech family side of it, we're obviously well versed in being able to extract the right data with the right teams. So I just wanted to make sure everyone knows that, like, you know, with extraction, there is quite a lot of, like, you know, additional, you know, work requirement that may be required from specific people. So we're always happy to assist, you know, within our support team in order to step everyone through. So just from a, you know, how do we find PenCat? Obviously, we've got our Insight portal that basically has all the details there. And obviously, this was a lot more targeted before it was part of the major new release. So if you're up to date with your release anyway, so if there's anyone that was under 10.44, obviously that, you know, then we would have had to go to the download center and apply a fix. But in the later versions and going into the new Medtech Evolution Plus format there, you know, obviously that's, you know, incorporated with, you know, the latest release fixes in there. Again, available support teams engaged to be able to help with any questions that may be of concern. And yeah, so basically, think in general, I think, you know, I hope that clears up where we are as a status, where those dates are as far as, you know, the next round of submission. And, you know, from what we've seen to date and how we are going to progress, obviously forward. Yeah, we're pretty much, that's what we've uncovered. So, Karen.
Thank you, James. So
No
far, we only
worries.
have one question,
Yep.
which I'll read out to you. In
Yep.
regard to alcohol, how will it extract the frequency and quantity of alcohol when under social history there is not a place to record this?
Yeah. So, that's interesting. So we have actually we have actually had this question raised before, and if I had it open, I would have actually gone into there. So there is so specific. I just might just open that question up to make sure that I point to the. So I've just gone on my screen so I can point to the specific of what they're saying. So alcohol, when the social history, there's not a place to record this. Yeah, so we actually have multiple ways we can extract the data if it's not, if there is some concerns with the placing or the data set or the frequency, which is quite a relevant point. We have seen that within that particular QIM. In past, with the support team, we've been able to create additional queries if required, and that's situated via our query builder. But obviously, there's been quite a lot of additional in our latest release of 10.4.6. There is a lot of additional fields based on the development of PenCat itself. So I think you'll find that in this particular for this particular issue with the social history, I believe in the past we have actually done an extraction via the query builder itself. But as I said, all this feedback is very helpful to us, because in the end of the day, when we roll out new releases, we're able to then, you know, point to fixes and the like that we've seen from client, because it's raised as a system enhancement. So I believe at this time that was a really relevant point. I believe that was released in the latest version of 10.4.6. But at the same time, I know specifically we have run specific queries and the like to assist with that information capture.
Okay, thanks for that, James. Does
No
anyone else
worries.
have any questions? Send them through. While we're waiting for any additional questions, I'll just cover off a couple of more housekeeping things. These client training webinars we'll be doing monthly, so we've got another one coming up next month. I can't remember the exact date, but we will keep you posted on that. We also do monthly to monthly business improvement webinars, which we hold to the market in general. And we've got one next week with Julie Smith, the finance guru from Grant Thornton, who's going to be speaking about how to improve profits in your practice and knowing what financial data to track. It's a really great presentation and really informative. So if you haven't registered already, I suggest you do. It's promises to be a really good one. And we'll also be showing a sneak peek of our new CBIT tool, Clinical Business Intelligence tool, that will be released with Evolution Plus. So even for just a preview of that, it would be worth attending. It's next Thursday, the 28th. Let us know if you'd like more information. If you haven't received an invitation, they went out yesterday. I think that's it for us, James. We don't seem to have received any more questions. You will receive a copy. Oh no, there's someone else coming up. There is so much current confusion with Query Builder at the moment. There are so many fields to enter, even with help, we were not able to extract correct data. James?
Does that come up on my screen, or I'll hold up. It's just popped up now. Let's just have a quick squeeze at that. Okay. So yeah, definitely. I mean, that's an interesting one, and I think Karen may have pointed to some of the more shorter hand, upcoming events in the form of webinars. I know that we have from our perspective, I think from an additional support perspective, we're looking to run a specific webinar just based on the use of Query Builder. Having said that, I will take in that information, obviously, because there's a concern there on the ability to use, and someone's there just pointed to a cheat sheet would be great. Yep, definitely. So I think that's what we need to focus on, because I think a lot of the time earlier on, it was more about what specifically are the PHN looking for. Now we understand that a lot better. So, but really, I will take your feedback as far as concerns with the Query Builder itself, and what was relevant. So I'd be interested to definitely, we definitely need to follow that up in order to assist you guys to submit correctly to the PHN. So, but yeah, Vicky made a point there, a cheat sheet. If that's going to help as well, definitely happy to, facilitate the paraphernalia as well out and the collaterals where required. So, yeah, as I said, the support team, obviously withstanding, there's a specific concern there with the Query Builder, but definitely we need to take in the specific terms and stuff that you saw the issues with, and then obviously get our support team to help you to extract the data and then collect that into Penn CS. So I definitely will welcome your feedback, and definitely would love to we'll definitely do a follow-up with you directly, so we can help you through that process.
And we were only saying just before the session started, you and I, James, that I was saying I'd love to do a webinar on Query Builder.
Yeah.
So that's something we can schedule next. We'll move the schedule around because we can.
Yeah, definitely. Definitely. I think it's what it is with Query Builder that, it's such an amazing tool, but I think everyone has different ways that they use the Query Build function. So I think in general, specifically using the functionality for that data set, for that issue, I can see where there might have been some confusion, Rain. So I definitely, I agree. I think we need to fast track our next webinar to just include tips and tricks on webinar, but definitely get out some of that material to our customers.
Yeah, and we'll look at doing a cheat sheet as well. That's something we can work on together, James. Okay, well, I think that's it for questions. If anyone has any issues with this, please reach out to support. They'll be more than happy to help you with your extraction. Good luck with it, and we hope to see you at our next training webinar. Thanks for your time today. Bye.
Amazing.
Thank you, James.
Thanks, everybody.
Bye.